Hi, this is Dr. Arun from ADRPLEXUS, and today we are going to see the top 10 world's costliest drug for the year 2018. So before moving on to this, let me tell, for any industry we need research, and for any research we need funding. But pharmaceutical industry is one industry which needs huge research, and that is why you find the drugs getting costlier day by day. So start with the world's number 10 costliest drug. It is Lumizyme, which is L-glucosidase alpha, and it is used for the treatment of a glycogen storage disorder, which is nothing but your POMS disease. So approximate cost, it is 1 lakh USD per year, and translating to 69 lakhs for a user per year. So this is the cost. 69 lakhs per year will be the cost of Lumizyme for treating POMS disease. So coming to the number 9, it is Rilonacept. It will cost somewhere around 2,50,000 USD per year, and this drug is being approved for the treatment of CAPS, cryopyrin associated periodic syndrome. Okay, one of the components of CAPS is Muckle-Wells disease. So one of the important features is that Rilonacept is going to block your interleukin-1 beta action. Another drug which also can intercept interleukin-1 beta action is anakinra. And more important, there is another monoclonal antibody which is used for the treatment of CAPS, that is cryopyrin associated periodic syndrome, and that mAb is canakinumab. Okay, it is canakinumab. So this is the world's number 9 costliest drug. Coming to number 8, of course many of you know this drug. It is Cinryze, which is a C1 esterase inhibitor, which is used for the treatment of hereditary angioedema. Average cost is going to be 3,50,000 US dollars per year, which roughly translates to 2.4 crores in Indian money. And for treating this, it is Cinryze which is being used. But one important thing is that this drug can be replaced by another mAb which has been recently approved in 2018, which is Landelumab. So let us see what are the drugs, other drugs which can be given for your hereditary angioedema. You have drugs like ecallantide, Landelumab, and Cantibant. Cantibant is a drug which blocks bradykinin B2 receptors, and your ecallantide is a drug which blocks kallikrein enzyme. This kallikrein enzyme is one thing which converts your high molecular weight kininogen to bradykinin. Okay, this bradykinin acts on B2 receptors which can be blocked by ecallantide. And the mAb, Landelumab, it also targets your kallikrein enzyme, which has been recently approved in the year 2018. Okay, now the number 7 world's costliest drug is galsulfase, which is used for the treatment of mucopolysaccharidosis 6, and the other name is Mato-Lamy syndrome. The rough cost per year, it is going to be 3,65,000 US dollars. So this becomes the world's 7th costliest drug for the year 2018. Now moving on to the world's number 6 costliest drug, ADRPLEXUS. This ADRPLEXUS is nothing but it's a purified form of the lysosomal enzyme iduronate 2 sulfatase. It is used for treating mucopolysaccharidosis 2, which is otherwise called Hunter's syndrome. The rough cost of this drug is going to translate in Indian money roughly around 3.5 crores per year. For treating this condition, it roughly takes 3.5 crores per year. So moving on to the next one, the 5th costliest drug in the world has been introduced in the year 2018. It is Serliponase alpha. Serliponase alpha is used for treating a rare disease called Batten disease, which is a form of neuronal ceroid lipofuscinosis. Serliponase alpha, the treatment per year for a patient is going to cost 4.8 CR at the current time. So it is roughly the cost of this drug is 7 lakh USDs per year. So this drug has been found to be very effective in treating neuronal ceroid lipofuscinosis. Okay, now the number 4 drug. This is a very popular drug, and this is one of the highest selling costliest drug. The sales of this drug is more when compared to the other costliest drug, and the drug is eculizumab. The brand name is Soliris. Eculizumab, as you all know, it is used for the treatment of your paroxysmal nocturnal hemoglobinuria, and this binds to the complement component C5, and the rough estimate of this drug will be costing some around 7 lakh USD per year, which again translates to 4.87 crores in Indian money. That is for per year treatment. This cost belongs to per year treatment for a patient. Okay. Now moving on to the number 3 drug. The number 3 drug is again looks very simple by name, glycerol phenyl butyrate. The brand name is Rhapsody. It's a simple name, glycerol phenyl butyrate, but this drug has been used for the treatment of urea cycle disorders, and this drug is being used to reduce the ammonia levels. So to keep the ammonia levels at the optimal levels in urea cycle disorders, this drug has been used. The rough costing of this drug, it's going to be 7,93,000 US dollars, which translates to 5.5 crores in Indian money. This is for per year treatment for a patient, 5.5 crores. Okay, now coming to the world's number 2 costliest drug. It's a gene therapy. It is for a rare condition, and the drug name is Oritogen nephrovac. It has been a gene therapy associated with adeno-associated virus, where the target DNA has been introduced to the cells to produce the deficient substance. Okay, for which condition this Oritogen nephrovac has been approved? It has been approved for a rare condition called Leber's congenital amaurosis, which has features of photophobia, nystagmus, and hyperopia. One important feature is that it has a dysfunction of pupillary reflexes, and this dysfunction is attributed mainly due to the dysfunction of photoreceptors. So what exactly this drug does? When it is injected, it is giving the DNA which can form the effective photoreceptors, so this condition gets overcome. So this is one of the novel approaches for treating Leber's congenital amaurosis, and right now this is considered to be the world's most costliest drug for the reason, because the reason is that it cost 8,50,000 US dollars for an eye, which means if it is going to be for 2 eyes, it's going to be roughly 17 lakh USDs. So let us translate this 8,50,000 USD in Indian money. It is 5.9 crores per year per eye. Okay. So one important thing you should know is that the gene therapies are the next level of treatment in most of the congenital disorders. So here this gene which is being taken by the carrier, it's going to be RPE65, that is retinal pigment epithelium 65 cDNA, which is being injected into the retina so that it produces effective photoreceptor cells which can overcome Leber's congenital amaurosis. Okay, now we move on to the world's number 1 costliest drug. The world's number 1 costliest drug since 2015 till 2018, it's going to be Alipogen tiprovac. Alipogen tiprovac is a gene therapy for a rare lipoprotein disorder, which is lipoprotein lipase deficiency, in which pancreatitis is a main feature. And this is considered to be the world's costliest drug even in the year 2018, and the rough estimate it is 1.2 million USDs, which translates to 8.36 crores per year. So for treating this disorder, if there is a patient who can afford, he should afford 8.36 crores per year. All these drugs have been researched and found out, but it cannot be given to the patients for treatment because of its huge cost. So it's all about finding drugs, but when it comes to the treatment, it's highly impossible. You can identify lots of patients with lipoprotein lipase deficiency, but even one cannot be treated by the world's costliest drugs. So this is about the world's costliest drug. To end with, I'm finishing with this gentleman called Jonas Salk. This is a gentleman who formed a real innovation in polio, and he didn't patent his research, and that is the reason he lost 7 billion from his own pocket. He didn't patent his research, and when people asked why he didn't patent the polio vaccine, he said, "There is no patent. Could you patent the sun?" Thank you, guys.